It's no secret that the healthcare system in Ontario faces real challenges: aging baby boomers, limited hospital and community resources, and the growing number of people living longer with chronic health problems.
It's going to be a real challenge. There's no question that our system is stressed as it is now, and it's going to be more stressed.
Just the sheer numbers of what's going on, the system's going to be basically overwhelmed. It's already overwhelmed. We're sinking.
The challenges are real. So are the solutions. For John, his life changed when he was on a car ride to see a friend.
Then the next thing I know, I woke up in the hospital. So I can't remember the 3 weeks I was in the coma, but apparently I was in a bad accident.
For Abdullah, he was gardening and suffered a stroke.
I was working in my backyard doing some planting. Suddenly sunshine came into my head. I feel pain in my both sides of the head.
For both Abdullah and John, their lives were saved in emergency units and acute care treatment, but given back through the expertise of complex continuing care and rehabilitation. Patients getting the right care at the right time.
What we accomplish in the long run is enormous. And we can make a very strong case for minimizing the amount of money that's spent relative to the amount of recovery that's seen.
John was severely brain injured in his car accident. Neurosurgeon Dr. Michael Cusimano was part of the acute care team.
He was in deep coma. We rate the scales of coma between 3 and 15. In his coma, the worst level is 3, which a person who is near death or dead gets, and his was a 3. And when it comes to these kinds of problems like John has, the first few minutes really make a major difference.
After receiving outstanding emergency and acute care, John was transferred to a rehabilitation facility that could give him the opportunity to rebuild.
It starts from day one, the person coming from acute care. Their life has been saved, no doubt about it, but now they're starting all over again to learn every basic function that you need.
We as a group can take that patient and maximize their function, and that's really what we're about. Minimizing disability and maximizing function.
Complex continuing care helps people recover who are also facing other kinds of complications. Abdullah, who suffered his stroke very recently, is just beginning to work on mobility challenges as the left side of his body has no movement.
Look at him standing tall. That looks great. Good. Couldn't do that before.
They give us hope,
Yeah.
Hope, like day by day they say, you do it, you do therapy, you listen to us, go back to your family.
Stroke care is one area of focus. Complex continuing care also treats patients recovering from hip fractures, lower limb amputations, and older frail adults with complex medical problems. Bob, who was working as a corporate communications specialist, suffered a stroke and loss of mobility. He is further along in his treatment than Abdullah.
Thank you.
Chin.
One of the big things of a stroke is like an earthquake of the mind. The mind gets just shaken, and all the little useful stuff you used to have very handy is gone. It's just not there anymore. And it's scary. It's scary when you look at a clock and you can't tell what time it is.
In complex continuing care, we have the time and we have the skill set that we can take these people and we can give them the skills that they need either to go home or to be lighter care in a long-term care institution. And by being lighter care, for example, that gives them a better quality of life.
Try to stay tall. Try to keep
I mean, you have to have a stroke like me or some of the other things that can happen to people to know how important it is to be able to turn those people around and put them back on the street as independent human beings. If this wasn't here, that would not be happening with me. So it's crucial for me for sure, and all the other people who are in here.
We're kind of in the middle of the continuum. So we are both touching the acute care partners and also affecting what happens downstream. We're touching the long-term care homes, we touch the CCAC, home health, supportive housing. And I'm excited by our position and all that because with a little bit of support, we can help the whole system. That flow down the river can happen a lot faster if we do a better job of moving people, taking people out of acute care, moving them, improving their lot in life, and then helping them to be placed, again, as independently as possible.
It's a lot cheaper for them to be here than it is for them to be in acute care. So I think if we can bring them in here as soon as possible and have greater accessibility for them for beds, we'll be making a lot of progress for the system in offloading acute care, moving people through quicker, getting them well faster.
You know, we can't do the work that we do without an effective continuum of care. It has to work seamlessly and efficiently for the beginning part to open up, otherwise everything just backs up. So we have to have that relationship and we have to have that teamwork with complex continuing care and rehabilitation.
A major challenge clogging the whole system is patients that are waiting in hospitals for an alternative level of care, or as they are described, ALC patients.
Unfortunately, we had to turn away somebody recently because they had to wait 6 months in this ALC bed. So had that person been here at the 3-week point or 4-week point, we could have helped them. But because it took 6 months for their number to come up to get here because of resource challenges, we just weren't able to offer any kind of decent solution because the stroke has matured so much by that point. We really couldn't work with them.
Dora is at the end of the journey that Abdullah is just entering. She and her husband Sam faced a series of medical crises that culminated in a stroke. Now Dora is heading home because of her hard work supported by complex continuing care.
And when I came here, I couldn't lift my head off the pillow. And they got me up and they got me to do exercises. And slowly I came back to myself. So what more can I tell you? I'm just so happy and thankful.
A lot of our patients don't, on paper, often don't look very good. And, you know, and when you see someone that you saw on paper that you looked at and said, oh, there's no way this person's going to make it home, and you get them home, it's an incredible high.
Thank God a million times. She's pretty well back on her feet, and so much of it is because of the care that she got here.
Absolutely.
I'd say I'd learned from the experience that there are good people out there who dedicate their lives to helping people like myself. The patience they have, the understanding, the compassion. They've taught me things about life, about people, how good people are and how they dedicate their lives to helping people like me. That's what I've learned.